The volunteers of our service league began their efforts even before Washington Hospital was a reality, and they've never wavered in their invaluable support of our hospital and its patients. Please join me in celebrating a proud heritage of more than 50 years of service and in honoring some very important members of the Washington Hospital family, our Service League volunteers.
In the spring of 1955, a small group of local women met with a single purpose in mind: to offer their support to Washington Township's proposed, sorely needed new hospital. Our Service League was born. Their plan was to offer assistance to patients, visitors, and staff, and to raise money for much-needed equipment. One of the first fundraising projects included a social hour at the home of Joe Walton. Each of the members donated 25 cents to attend. The beginnings may have been humble, but the depth of dedication and caring of these early volunteers was enormous. By the time the first patients were admitted to the new hospital, the League opened a gift shop, and volunteers manned the lobby desk, assisted in discharging patients, and helped transport patients to X-ray and the lab. It was through ambitious fundraising efforts of League volunteers that the hospital was able to acquire much-needed equipment in the beginning, and then to open the first ICU west of the Mississippi in a non-teaching hospital. When the hospital needed something, from carpeting or a hospital library to renal dialysis equipment or a telemed system, it was the Service League volunteers who found a way to raise the money to make it happen.
Over the years, I've seen each year a very generous amount donated to the hospital and also to the hospital foundation. They were great in the support when they formed the hospital foundation in 1983. They were major contributors, and they encouraged us, and they've gotten involved with everything associated with the hospital.
Over the years, the ongoing fundraising efforts of the League volunteers have been a crucial factor in the hospital's growth and its ability to better serve the Tri-City area. But if you were to ask patients or their friends and families about these volunteers, they wouldn't likely mention any of this. No, they would tell you about the warm smiles, the friendly, helpful attitude, or the quiet hours a volunteer has spent with a patient or a nervous, frightened loved one.
I think it's often said that when people walk in the hospital, the first face they see is that of a volunteer. And I think we all just enjoy being that happy face. And volunteers are, resourceful. They have good ideas. They think of different ways to raise funds. They think of different services that the hospital needs, and they have the desire to do just that.
Volunteers can be found just about anywhere in the hospital where there's a need for a helping hand or a kind word.
Volunteering here at the hospital is important to me because this is my community. I'm a native of this community, and we are helping all of the people in one way or another with their health needs. Even though I might not be involved with the patient directly, it's involved with a relative who comes into the gift shop to get something for them, or in the library where they come to get some information for themselves. So that's important to me.
You might see a volunteer greeting patients and visitors, discharging patients, making deliveries, giving tours, helping staff to feed patients, or providing emotional support during physical therapy.
They're the great spirit of the hospital. Volunteers are there because they want to be there. They're out in the community telling people about what a great hospital we are. And I think it's always wonderful to have somebody who is a volunteer be involved with the patients. They're kind, they're caring, and they just want to make sure that the patients have the best experience they can in the hospital.
Today, the League is flourishing. Fundraising efforts are as strong as ever, and its highly active volunteer program is generating new opportunities that go beyond the typical volunteer duties. While Service League volunteers have traditionally performed the essential functions of staffing the lobby desk, new opportunities like the patient feeding program allow volunteers to work one-on-one with patients.
It is really a special blessing that we get from them. You don't get paid, you come on a day-to-day basis to help patients. It's really something. It's a very special gesture from anybody that can do that. They're very special people, just very, very special.
Once known as Washington Hospital's Pink Ladies, the Service League volunteers have come to include women, men, and students who reflect the diversity of the community we serve.
One of the things that has really always struck me about volunteering at Washington Hospital is you feel very connected to the community. And that's one thing I just have loved. You know, you meet the people that have kind of made this community what it is, the people that have been around here, that lived here their whole lives. You meet the patients, you're meeting people from all different cultures. I mean, you don't get an opportunity to meet those many people and in those type of circumstances, and I really enjoyed that.
The extraordinary efforts of the men and women of Washington Hospital Service League have resulted in donations that are fast approaching $2 million. But impressive as that number is, let's not forget that the volunteers of the League are also approaching 2 million hours of service. The numbers, 50 years, millions of dollars, and millions of hours, signify a tremendous accomplishment. For patients and their families, though, it's the special moments when a volunteer was there to hold a hand, offer a warm hug, or reassurance to an anxious family member that will never be forgotten.
There is no way to truly measure the worth of the efforts of the Service League volunteers over the years. They continue to provide invaluable help to the hospital staff and our patients in too many ways to count. I would hate to think where we would be without them. I know I speak for all of us at Washington Hospital when I offer our heartfelt thanks for more than 5 decades of unmatched dedication and for a job well done.